Hey everyone, so this is renal and urinary quiz, and I just want to say that I'm just learning this with you guys. I'm not trying to teach or anything like that, so I'm just going to read them, and then when I'm done reading the options, you can just pause it, and then I'll just, if I know the answer, I know it, and if not, I'll talk myself into picking something. Okay, so number one, which pediatric anatomical difference makes young children more susceptible to kidney trauma compared to adults? A, the loop of Henle is fully mature and elongated at birth. B, the kidneys are located higher in relation to the ribs. C, the renal capsule is thicker and more fibrous in infants. And D, they possess significantly less paranephric fat. You can pause now. Um, I'm pretty sure it's D because less fat would make you more susceptible to trauma. Um, I'm not positive about A. B is not right because the kidneys are located lower than the ribs. I'm not positive about C, but I think probably not because everything in infants is like thinner and weaker, and so yeah, that's why I'm going to go with D. A lack of protective paranephric fat in children provides less cushioning, making the kidneys more vulnerable to external impact. A nurse is calculating the expected 24-hour urine output for a 4-year-old. According to the source material, what is the average range for this age group? A, 540 to 600 milliliters, B, 600 to 1200 milliliters, C, 500 to 780 milliliters, D, 1000 to 1500 milliliters. I'm pretty sure this is C. This is the documented average 24-hour urine output for children in the 2 to 5 year age bracket. Okay. What is the primary purpose of placing a newborn with bladder exstrophy in a supine position with legs raised in traction at 90 degrees post-operatively? A, to prevent failure of the surgical bladder closure. B, to prevent the development of hip dysplasia. C, to enhance gastric emptying and prevent reflux. D, to encourage the immediate development of bladder control. And I know the answer to this, and it is A. Maintaining this strict position for 4 to 6 weeks is essential to reduce tension on the surgical site and ensure the closure heals properly. A nurse is providing preoperative care for a newborn with bladder exstrophy. I'm sorry, I don't know if I'm saying that right. Which intervention is most appropriate to protect the exposed bladder mucosa? A, applying a sterile dry gauze dressing to absorb urine. B, applying a thick layer of antibiotic ointment directly to the mucosa. C, encouraging a tub bath to keep the area clean. D, covering the bladder with plastic wrap. So I know the answer to this too. This is D, covering the bladder with plastic wrap, which seems super weird, which is probably why I remembered it. It keeps the mucosa moist and prevents it from sticking to clothing or diapers, which would lead to tissue damage. Why is circumcision contraindicated in a newborn male diagnosed with hypospadias? Also, I don't know if I'm saying that right. A, hypospadias usually resolves spontaneously without surgical intervention. B. The infant's blood pressure is typically too unstable for minor surgery. C. The foreskin may be needed for future surgical repair. And D. The risk of pre or post-operative hemorrhage is significantly higher. This is the foreskin may be needed for future surgical repair. Surgeons often use the foreskin tissue to reconstruct the urethra during the surgical correction of hypospadias. According to the AAP guidelines, what bacterial count is considered a positive result for a UTI when the specimen is obtained via sterile catheterization? Oh, okay, so greater than 50,000, greater than 10,000, greater than 1,000, greater than 100,000. I have no idea on this one. I mean, I think your bladder is sterile anyway, right? So wouldn't any amount be enough to make it positive? So like, I don't know. I'm just gonna choose 1,000 because, and I could be wrong, but I think that the bladder is sterile already. It shouldn't have any bacteria in there. I don't think. I don't know. Oh, it's wrong. Okay, so 1,000 isn't right because this threshold is too low and may reflect minor contamination rather than a definitive infection. And 10,000 is correct because 10,000 colony forming units per milliliter is the threshold for a positive diagnosis. Okay. A child with, oh gosh, let's just say VUR, vesicoureteral reflux, I don't know how to say that, is instructed to perform double voiding. What is the primary clinical goal of this technique? A. To strengthen the pelvic floor muscles. B. To provide a more accurate 24-hour urine specimen. C. To increase the child's daily fluid intake. D. To reduce urinary stasis and the risk of infection. I mean, it's got to be D. If you don't get all the urine out, it just stays there and can fester, so I'm going to go D. Double voiding ensures the bladder is emptied more completely, preventing urine that refluxed into the ureters from remaining in the bladder. Okay. In pediatric patients, hypertension is most commonly associated with which of the following? A. Chronic respiratory infections. B. Renal dysfunction. C. Primary cardiac disease. D. Congenital neurological defects. I'm going to go ahead and say renal dysfunction since we're going over a renal quiz, but if I'm being honest, I didn't know that. The source material specifies that pediatric hypertension is more frequently related to renal issues than cardiac ones. Interesting. Which clinical manifestation is a hallmark of acute post-streptococcal glomerulonephritis? Okay, A. Profuse clear urinary output. B. Severe hypotension and dehydration. C. Smoky or tea-colored urine. D. Marked hyperlipidemia and clear skin. Acute post-streptococcal glomerulonephritis. Okay, so I don't think it's A. I think it's gotta be, no, I don't think it's B either. Because I thought renal problems give you hypertension. That says hypertension. Smoky or tea-colored urine. Oh, it might be that. Because the oh my god. What is it called? I forgot what they're called, but the glomerular thing in the glomularis, or whatever it's called, doesn't that filter the urine or something? I'm still gonna go with that one, because everything else seems like, why would you have clear skin? And I think you get hypertension. And why would you get clear urine output? Oh, maybe it would. No. I don't know. I'm gonna go with this one. This characteristic color is caused by profuse hematuria associated with glomerular inflammation. Oh my gosh, I can't talk. Okay, so my thinking wasn't right, but did I answer right? The pathophysiology of nephrotic syndrome is best described as which of the following? A bacterial infection of the bladder spreading to the kidneys, congenital absence of one or both kidneys, altered glomerular permeability resulting in massive protein loss, obstruction of the ureters leading to renal pelvis dilation. I don't know what nephrotic syndrome is. A bacterial infection of the bladder spreading to the kidneys. It's not that. Congenital absence of one or both kidneys. I don't think so. Of glomerular permeability resulting in massive protein loss. I don't think it's D. I don't feel confident about any of them, but I'm going to go with C. Nephrotic syndrome involves the fusion of glomerular membranes, allowing large amounts of albumin to escape into the urine. Okay. A child is being treated for nephrotic syndrome with long-term prednisone therapy. What side effect should the nurse prepare the family for? Cushingoid moon face appearance, rapid weight loss and sunken eyes, increased bone density and height, severe hypotension, and salt wasting. I feel like Cushing syndrome is like the moon base. And I feel like, well, it says it right here that it's the moon base. But I feel like with Cushing's, you have to take steroids, which makes you blow up and get the moon base. So it's got to be A. Yeah. Long-term corticosteroid use commonly results in fat redistribution, including a rounded face and extra hair growth. When educating a parent on preventing recurrent UTIs in a young female, which instruction is the most important? A. Restrict fluid intake to twice a day to reduce voiding frequency. B. Provide high-protein diets to acidify the urine. C. Wipe the perineum from the front to the back after voiding. D. Encourage the use of bubble baths and hygiene sprays. Obviously, this is C. We all know this. Which intervention is recommended for a child with I don't know how to say it, enuresis, to help develop an arousal response at night? Using a moisture sensing alarm system, restricting all fluids for 6 hours before bedtime, lifting the child while asleep to use the bathroom, performing bladder stretching exercises during the day. I don't know if I read this or heard it in lecture, but I do know that the answer is A. And I'll tell you, I think that the answer is stupid, because if somebody's wetting themselves and then an alarm goes off, it's probably just going to make them continue to wet themselves. I don't know. Anyway, this is how I remember things sometimes. Like, if I disagree with it, I think it's stupid, then I'll remember it better. A nurse is caring for a child post-ureter reimplantation for VUR. The child has 2 ureteral stents and a suprapubic catheter. What is a critical nursing assessment for the stents? A. Ensuring the collection bag is kept above the level of the bladder. B. Verifying that urine from the stents is profuse and bright red for 5 days. C. Clamping the stents if suprapubic tube starts draining. D. Checking that both stents are draining equally. A is wrong. B is wrong. I think it's got to be D. I don't know. Assessing that both sides are draining equally ensures that both kidneys are producing urine and the stents are patent. What is a key nursing application of the Healthy People 2030 goals regarding renal disease in children? A. Discouraging organ transplant procedures to focus on dialysis. B. Mandating home peritoneal dialysis for all children with BUN greater than 50. C. Educating parents to give antibiotics for streptococcal throat infections. D. Providing mandatory DNA analysis for all newborns. I mean, I feel like the only... Wait. Well, you would want... The goal of the Healthy People 2030 is like promoting like health, like preventing stuff. So I would say that it's gotta be C, because if the parents treat strep throat, it can prevent complications from strep throat, which include rheumatic fever and um, whatever, the glomerular, whatever problem. So I think it's gotta be C. It's the only prevention. Yeah. Glomerular nephritis. Okay. Hey, I did good.